Welcome back to Great Day Medical Monday. When there's a disease that threatens large populations, the medical community responds. We saw that with the modern day vaccines to fight pneumonia, HPV, shingles, and COVID. A lot happens between the discovery of a virus and the actual shot in the arm. You have an opportunity to contribute to medical advancement simply by participating in clinical research. Here to tell us about trials in Houston and how you could possibly be a part of them is pediatrics and internal medicine, Dr. Clifford Yut. Good morning, Dr. Yut.
Good morning, Deborah. Thank you so much for having me here today.
Well, thank you for being here, because this is a part of medicine that I think so many of us are not familiar with. You're a physician at Highland Health, and you partnered with Javara to help run these trials to get information. Explain to us, if you can, I know it's a very long, arduous process, but when it comes to trials, by the time you get to the trial part, a lot of work has happened before then.
Oh, absolutely. There's a lot of background information that happens. I mean, as we're approaching kind of this whole cold and flu season, I mean, we need to think about things that all of us can do first off in terms of how do we try to prevent illnesses. You know, we can focus on our health, focus on our well-being by making sure we get proper sleep, proper rest, good hydration, good nutrition, regular exercise. We can do things like minimizing exposures towards infections by good hand hygiene, washing our hands well, not sharing cups, foods, liquids, utensils, and keeping our hands away from our face. And then lastly, the third and most important part is doing these vaccination trials. And these trials we've been part of for several years duration. And again, we were part of the COVID vaccine trials in terms of where we were able to generate information that these vaccines are not only safe, but very effective in preventing severe infections, hospitalizations, and bad outcomes associated with these vaccines.
Yeah,
we were also,
and let's clarify, because we know whenever you talk to somebody about, hey, did you get your such and such vaccine? It's like, no, I never get the flu, or no, so there are some misconceptions also about vaccines. Like one of them is, oh no, because it's a touch of the disease in there, and I don't want to get a touch of the disease.
Absolutely. Unfortunately, there's lots of misinformation about vaccines out there. And there's lots of people who think that they'd rather actually get the infection itself and let their body fight off the infection on its own rather than get a vaccine. And frankly, at the end of the day, whether you get an infection, whether you're vaccinated or not, the person who is vaccinated, their body prepped and studied for that illness, and therefore they have a much better chance that if they do get exposed, that their illness tends to be milder in nature, tend to be shorter in duration. They have less chance of complications, and the contagious period is far less. I mean, we need to think about vaccines as kind of like going to school or studying for an exam. By going to school and studying, you're much better prepared and you're ready to kind of fight off infections, and therefore the same illness will have a much milder course for you.
All right. What are some of the advantages of somebody saying, hey, raising my hand, I want to take part in the trial?
Well, individuals who take part in clinical trials, the important part of trials are that they are a cornerstone for advances in medicine and healthcare. These individuals primarily benefit in terms of having access to brand new technology and state-of-the-art in medical care at a far sooner rate than they'd otherwise have if they were waiting for that process to occur from a general standpoint. Additionally, they benefit society as a whole. These individuals are helping to contribute towards medical information. We're advancing technologies. We're making new medical protocols for the general population. Thirdly, they're helping to advance society as a whole, and they're doing their part for the future of medicine and healthcare.
Yeah, and the reason why we have vaccines for things like meningitis, influenza, and now the new RSV vaccination is because people did take part in those trials before. Those clinical trials can benefit everyone, but in particular, we have some more vulnerable populations.
Absolutely. So you're correct. Everyone benefits from vaccinations, whether directly or indirectly. But certainly there are some higher population groups which are at greater risk for infections. And you could think about newborns and infants. Those individuals, just by the sheer nature of their immature immune response, they're much higher chance of having complications. On the other end of the spectrum, our elderly population, as we age, our immune system doesn't tend to fight off infections nearly as well, so they're at much higher risk. We could think of immune-compromised individuals, such as a person who has cancer or undergoing chemotherapy. And then there's certain disease states like diabetes, asthma, patients who have sickle cell disease, smokers, as well as individuals under certain occupations, such as childcare workers and daycare workers, as well as teachers or educators and healthcare staff. They're all at higher risk due to exposures. And then we can also think about individuals who travel frequently, those who visit the airports and get in their airlines. They have lots of exposures at those locations, as well as the individuals who may go on their dream vacation and get on a cruise line. And when they get on that line, they're around their closest 2,000 individual friends, and they have lots of contacts and exposures. And that's when we tend to see outbreaks of things like norovirus.
Yeah. Some available clinical trials. One of them is something that I know a lot of people are like, saying thank you. Endometriosis treatments, because that's a tough one for a lot of women. Cardiovascular disease research, flu vaccine research, norovirus, and at Javara's locations throughout the greater Houston area is where these clinical trials are taking place?
Absolutely. So we're enrolling currently at all 3 of our clinical centers through the greater Houston area for those vaccinations and more.
All right. General qualifications for people. And in some cases, people can be compensated, correct?
Absolutely. So individuals are compensated based off of a stipend, which is developed based off of each individual study, the study duration, and what's entailed as part of their vaccine trials.
All right, Dr. Yut, I'm going to end with something I actually heard the other day, and I kind of went, wow. Someone said, do we really need vaccines? She goes, like polio. We don't really have polio anymore. And I'm like, well, polio is still out there, but we don't see the widespread of it anymore. It's because of the vaccine.
Absolutely. Unfortunately, lots of individuals feel that they don't need to get vaccinated because they don't see these diseases. These diseases are still out there, and recently we've seen a marked increase in illnesses associated with vaccine-preventable disease states, and that's unfortunately because people just haven't seen these things. Well, we've had a perfect example with COVID recently in terms of what an illness can cause and the havoc that it causes for society.
All right, Dr. Yut, thank you very much.
Thank you so much, Deborah, and have yourself a wonderful day.
Thank you. If you're interested in learning more or enrolling in a clinical trial, you can contact Javara at 713-429-1836. Again, here's the number. It is 713-429-1836. Remember, you might even receive compensation for your time. You can also sign up by visiting their website at javararesearch.com/patients, or you can email them, and here's that address, genesis@javararesearch.com, genesis@javararesearch.com.